A very warm welcome, everyone, to today's webinar on digital health, brought to you by Africa Health Business. My name is Christine Hoogendoorn, and I'm the Business Development Manager at AHP. As you see, we have a wide audience dialing in today with delegates from across the globe. Before I introduce you to today's moderator and we start the webinar, I would like to take you through some unmute during this session. Please 20 minutes easily time during this. I would like to listen to the French translation.
Pour la traduction.
Oh, my apologies. I'll start again. One moment, please. Okay. Apologies for the slight hiccup, but I would like to wish you a very warm welcome again to today's webinar on digital health, brought to you by Africa Health Business. My name is Christine Hoogendoorn, and I'm the Business Development Manager at AHP. So as you saw, we have a very wide audience dialing in today with delegates from across the globe. Before I introduce you to today's moderator and we start the webinar, I would like to take you through some housekeeping rules. Attendees will be on mute during this session, and please note that you can put your questions in the Q&A section on your screen. Your typed questions will be responded to as much as possible. This is a 90-minute event. Please observe the allocated time during this session. The webinar will be held in English, but if you would like to listen to French translations, please click on the translation button on your screen and don't forget to mute the original audio. And finally, during this session, you can switch on your camera. I would also like to take this opportunity to show you a couple of short videos from our event partners who contributed to this event. Some of you have been with us for a long time, and some are new partners. We're very happy that you're here, and a warm welcome to all of you.
This is life. A moment of joy. A dream come true, all pure love. A tiny breakthrough, or maybe a triumph. A constant struggle, a clash of ideas. We can make a difference. Create the new, the unexpected. Leading us to feel great, strong, or simply human. Constantly questioning, are we curious enough? Could we be closer? Can we?
Medtronic Labs is built upon 5 principles. First, we design with and for the communities to address local barriers across the care continuum. Second, we employ evidence-based practices and protocols for uncompromised clinical excellence. Third, we address the social determinants at the root of poor health. Fourth, we integrate digital and product technologies for high-tech, high-touch models of care. Fifth, we innovate operational models that enable efficiency at scale. Learn more at www.medtronic.com/Medtronic Labs.
The world is on the brink of a digital revolution. Almost everyone in Africa has access to a mobile phone. To capitalize on this opportunity, we've initiated a digital platform that connects all players in the healthcare market, bringing transparency, efficiency, and direct access to and for end users. This technology generates a wealth of data that can help improve quality of care in unprecedented ways. And donors, governments, insurance companies, and even individuals can reach vulnerable groups or family members directly or contribute to digital funding pools, knowing for sure that their money will only be spent on health.
Here you see the agenda for today's event themed Digital Health. I would like to reiterate that this is a 90-minute session. And now I would like to move on to a partnerships announcement between Africa Health Business and Smart Africa.
Digital connectivity is at the forefront to improve health in Africa now more than ever before. Today, Smart Africa and Africa Health Business are proud to forge a partnership toward the Africa of tomorrow.
My name is Dr. Amit Thaka, and I'm the chairman of Africa Health Business. Today, we are really delighted and proud that we are joining hands with Smart Africa. Africa Health Business is headquartered in Nairobi, Kenya, and we bring together public and private sector leaders from across the globe, trying to create this incredible partnership to improve healthcare across all the countries in the continent. Smart Africa is headquartered in Kigali, Rwanda. They've been an umbrella body receiving great political goodwill and great partnership from corporates, not only in Africa, but around the world. Today, we are shaking hands, going to work together to improve health across all the countries in Africa. If you want to get involved, you want to participate, please feel free in getting in touch with us at AHB or even Mr. Lassina Kone from Smart Africa. Joining us today on behalf of Lassina Kone, who is the Director of Technology and IT at Smart Africa, is Mr. Dider Kuriki Yumfura, who I would like to now invite to say a few words on our partnership. Mr. Dider, you're welcome from Kigali. Over to you.
Thank you very much, Dr. Amit Thaka. Good afternoon, everyone. Delegates of the UN organization, private sector partners, distinguished participants, ladies and gentlemen, it's a pleasure on behalf of the Director General and CEO of Smart Africa to be with you today and participate in this session to discuss digital health solutions and how they are supporting the fight against COVID across the continent. Let me start by congratulating you for rallying across a common purpose for seizing this very peculiar moment in history that the coronavirus outbreak is, with all the challenges posed that's being addressed in Africa and outside Africa. This is a moment where we can really make a difference together. The pandemic that was declared as such on 11th of March 2020 by the World Health Organization has grown in size and in proportion across the world, and Africa is not an exception. The numbers have been growing rapidly to over 660,000 cases today and over 14,000 deaths in a relatively short space of time. The Smart Africa Secretariat has taken concrete actions to fight the pandemic, and we are happy to partner with this range of partners led by the Africa Health Business to work together, because the strongest lesson we've learned during this time is that in time of crisis, we must come together and we must be solution seekers. Dr. Amit, it's a pleasure to join the efforts that you are leading, and we at Smart Africa Secretariat look forward to continue to work together with you and with all the range of partners to increase the impact that each of us individually will never be able to achieve. So we thank you for today, and we look forward to continue to work together and to increase the impact through this collaboration and this partnership. So I thank you again for your attention, and looking forward to work with you. Thank you.
Thank you. Thank you so much. I'll turn it over back to Christine. Thank you, Didier.
Yeah, thank you both for this great announcement and congratulations. And now it's also my great pleasure to introduce you to the moderator for today's webinar, Dr. Ademola Olajide, Country Representative for UNFPA Kenya. Welcome, Dr. Ademola, and enjoy the webinar.
All right, thank you very much, Patricia and colleagues.
Thank you.
Good afternoon.
I'll turn it over back to Christine.
Now, we do know that on the
thank
African
you both for
continent.
this great announcement and congratulations. And now it's also my great pleasure to introduce you to the moderator for today's webinar, Dr. Ademola Olajide, Country Representative for UNFPA Kenya. Welcome, Dr. Ademola, and enjoy the webinar.
All right, thank you very much, Patricia and colleagues. Good afternoon, colleagues. I seem to be having an echo, but I will still go ahead because I'm sure you can hear me. We do know that on the African
continent for this great announcement and congratulations.
Oops.
And now it's also my great pleasure to introduce you
Hello.
to the moderator for today's webinar, Dr. Ademola.
How are you, Dr. Ademola? Try again. I hope the echo is now dropped off. I think Dr. Ademola is reconnecting. As he reconnects.
Yes, I'm here. Can you hear me?
Oh, it's so much better. We can hear you loud and clear.
Great. Thank you. Thank you very much. Good afternoon, colleagues, participants. Good morning, good evening, wherever you are in the world. I think right now, for us in the global community, clearly the word health has assumed a new meaning and a much more significant importance. We have seen over the last few months, heads of states and government continue to engage themselves on the subject of health. Also on the African continent as well, health has become something that the impact has gone beyond traditional health sector. We have begun to see the involvement of actors that are traditionally not part of the discourse because they have felt the impact of a crisis which had started in the health sector. Of course, the world has always experienced inequalities with regards to access to health. And Africa has unfortunately borne a disproportionate burden with regards to disease, as well as health outcomes. And this on its own provides also a unique opportunity for new approaches and what we will term business as usual. Leveraging innovation is one of the key ways by which we can bridge the divide and also enhance access to healthcare on the African continent, as well as improve health outcomes, which seems to have been something that the African leaders have achieved some level of consensus with regards to that outcome. In 2001, African heads of state and government met in Abuja and came up with what we call the Abuja Declaration. This was re-emphasized in 2005, again in 2013. And so repeatedly, we have heard African leaders converge with regard to the issues of health. And of course, in 2017, on the sidelines of the World Health Assembly, African ministers of health came together in a forum that looked at digital health leadership, where they all agreed that it was important for them to build a robust digital health ecosystem that would allow them to leverage and optimize the benefits. Of course, we now live in this era of the COVID-19 pandemic, which of course started out as a health crisis, but has morphed into an economic crisis, a security crisis, a social crisis. It has exacerbated existing inequalities, and of course created for us consequences well outside the health sector. It has created what we have termed a shadow pandemic. And of course, with regard to the health sector, it has reduced access, because we find the larger members of the community being a little bit reluctant to access the healthcare delivery system on the fears of COVID-19. We've seen African health policymakers divert lean resources from routine service delivery to responding to the COVID-19 pandemic. We've seen a rapid scale up of health infrastructure like never seen before. We have seen the involvement of the private sector, albeit in provision of donations, in leading the discourse, in helping governments rapidly scale up its capacity. What we are seeing right now is a consensus amongst all stakeholders, from the health sector to the private sector to the economic sector to the range of leaders, that there's the need for the development of a robust and viable ecosystem that goes beyond the traditional partners as we respond to this pandemic and emerge from it. So we then need to look at what role does digital health play in all of this? What are the opportunities that are available to us? What can we do differently that when we emerge from this crisis, we emerge stronger, we emerge better, we've got a more viable ecosystem that helps us improve access, improve efficiency, deal with inequalities. Because one of the things we have seen immediately in the education sector is that kids who have better access to the internet can continue their education. And so that digital divide, which we seem to have ignored years ago, seems to be creating a much more patent socioeconomic and education divide. So how do we as health sector actors move to ensure that when we emerge from this, the digital technology does not reinforce existing inequalities, but better still makes us efficient, create a system that we can sustain, and more importantly, lead us to the point where we can democratize the decisions as relates to health. We've heard the discourse that certain countries have weak health systems and probably will bear a bigger brunt of the COVID-19 pandemic. But that has been a challenge, because those systems that those countries that were assumed to have stronger health systems seem to be taking a very fatal blow. Therefore, it requires us to interrogate our definitions of health, to really remember that health is a product that we produce by actions we take at the individual level, at the family household level, at the community level, and ultimately at larger society and in the hospitals. Strong hospital systems alone will not deliver the health outcomes we seek. We have seen where basic health decisions, basic key health promotion actions, which individuals and communities need to take, have become politicized. How can we leverage digital health to the extent that individuals can access the information they need to be able to take decisions that improve their health outcomes and the health outcomes of society without having to go through the veil of political leaders whose actions are motivated purely by reasons other than health? We see that happening today. And so today we're going to be looking forward to a robust discussion, seeing the various interventions, services, and innovations available to us as a constituency and as a community, and how we can leverage it. That from taking these discussions from this forum, we're going to be able to apply it to an Africa that is waiting, an Africa that is hungry, an Africa that is ready, and an Africa that has a responsibility to ensure that irrespective of social status, we must be able to get to the health outcomes that we seek. So today we've got a brilliant array of panelists and speakers, and it's my pleasure to invite Robin Njiru, who is the business lead for East Africa for Amazon Web Services, who is going to give us the keynote, and over the next 10 minutes is going to set that pace, and then we will dive into it. Robin, welcome. Take it away.
Thank you, Dr. Ademola, and I hope that you can hear me very well.
Loud and clear, sir.
Awesome. Thank you. I think you already set the pace for all of us, and you did it so passionately, so very excited to take over after you. As mentioned by Dr. Ademola, distinguished guests, delegates, participants, ladies and gentlemen, good afternoon, good morning, good evening, depending on the various parts of the world that you're in. I'm Robin. I work for Amazon Web Services, and I intend with the next 9.5 minutes just give our perspective of digital health and the opportunity that we see and also the role that we're playing. And therefore, I'll work with my partner in terms of continuing to move to the slides, and so that then we can just get a good view of our perspective as Amazon Web Services. And kindly, I just ask you to move to the next one. And this just moves on to the point that Dr. Ademola mentioned. It's interesting and also a challenge when you look at the healthcare statistics across Africa and note the percentage of GDP that African countries and governments are spending. And you'll notice that there is such a limited spend, and also from an expenditure and also from a health worker perspective, we are in single digit and lower single digit kind of investments. And therefore then when you look at the outcome, it gives now numbers and percentages to the perspective that Dr. Ademola was giving us, where we are accounting for half of the world's deaths in terms of children under 5 are having the highest maternal mortality rate, and also are carrying quite a heavy burden from HIV, tuberculosis, and malaria. But as we think this afternoon or evening about digital health, therein lies a great opportunity, because even in recent years, we have started to see the role that digital health is already playing in parts of Africa. And digital health as an ecosystem really is how ICT then is utilized and as enabler, either as an enabler and accelerator to improve healthcare delivery. Moving a little forward as we then move, it's interesting. I'm very impressed that I think 20 minutes into the call, or 25 minutes into the call, as we think about this season of COVID-19, when you look at the headlines, you don't get a very positive outlook of Africa's war against COVID. The headlines kind of tend to tell us a very grim story, a very doom and gloom kind of perspective. And I was actually, there's a friend of mine who was joking with me about a week ago saying, there's actually additional words into our vocabulary. Now we have words like unprecedented is a word that on every particular day, you kind of hear unprecedented so many times. The word masks, social distancing, and this is now becoming a common item of our everyday engagement. And therefore, as we move on, Amazon Web Services would like to share our own perspective of where have we come from, where are we at, and where do we see the future in the role that we play in terms of digital health. At a very introductory level, for those that may not have interacted with us, we come in as the world's most comprehensive and broadly accepted cloud platform. And for purposes of today, I mean, cloud is not very new into the world, but 13 plus years is not, again, very, very recent in terms of technology years. But specific to healthcare and life sciences, we come with over 7 years of experience. And on the top right of the slide that we are all looking, you will see that as Amazon, these are the roles, not just that we speak to in terms of our customers and partners, these are actually the roles that exist within our own teams. And therefore, within our own teams, we have chief digital officers, we have population health leaders, we have pharmacologists, we have health information officers. And what they do is they then contribute and every day dedicate their lives to that healthcare and life science practice. With Amazon, we are then bringing a combination of both technology expertise and also industry knowledge to then make Amazon Web Services your trusted technology partner. You'll notice on the slide that we've put up, the patient is at the heart of every single thing that we do, as when we refer to digital health. Our vision as Amazon is really to be the most customer-centric company on earth. And when we think about healthcare, the patient is really our customer in this case. And therefore, when we think about the health industry, this is a highly regulated industry, but we also are seeking to then help unlock the potential of healthcare data. In technology, we use a term that data is the new oil, meaning that everything is really running on data, but data for data's sake is really irrelevant. It's what we are then able to leverage with the data that we have access to. And therefore, you'll see we've put a broad array of the partners and partnerships that we've built through providers, governments, vendors, NGOs, and even up to payers to just ensure that our engagements are broad-based to ensure that we have the capability to transform the healthcare, because no single organization or company has the single capability to transform this industry. And therefore, we have a thriving global partner network that is able to drive deep domain expertise to support our intentions in the healthcare industry. If we move a little ahead, now having talked a little bit about us, it's interesting to then get how we then look at the digitally enhanced healthcare. As Amazon Web Services, we view this in 3 levels. Level number 1 is what we call IT cloud transformation. Level 2 is what we refer to as predicting healthcare relevant events. And level 3 is the one that's a lot, very, very broad on our pages, that refers to personalizing the healthcare experiences. What does this really mean? And I'd like to spend a minute or two on this. From an IT cloud transformation perspective, this refers to how, as healthcare specialists, providers, payers, insurers, how is your technology and data set up? Is it easy to access? Is it secure? Is it scalable? And does it allow you to be able to innovate? Because one of the things that we are experiencing during COVID-19 is that there is such a significant amount of data. And the problem is both structured and unstructured. And one of the challenges that we are seeing amongst our partnerships is that there is, with a significant amount of increase in data, organizations are struggling to then really make sense of it, or rather pick knowledge from the data that they have, which then speaks to the second category of where we see digitally enhanced healthcare, which is predicting healthcare relevant events. And this now speaks to, we already have the data, it's secure, it allows us to innovate, it allows us to scale, it allows us also to be able to access it as easily as we need to. And therefore, the second piece involves our ability to enable the healthcare industry, analyze and unlock the potential of that data. And this speaks now to driving efficiencies in both the clinical and operational aspects of healthcare. That means that we are looking at, when we think especially about the vast amounts of data, we refer to it as big data, we're looking at using the most complex computer algorithms to be able to then extract the knowledge from that data and then be able to detect and respond to public health threats that otherwise would have been undetectable due to either incomplete data or limited computing ability or strength. And then with our ability to then pick up these trends, it also increases then the third piece, which is then our ability to predict outcomes from analytics. And what then does this mean for our customer, and in this case, the patient. This then enables their experience to be both better and also improved in terms of both their own experience and also the outcome. Because there's a risk that as we think about our customers, in this case, the patients, to give a very broad single brush approach, as opposed to then using the data and insights that we have developed by ensuring that that data is extracted correctly to be able to then predict outcomes and ensure that even as we interact with them, we are then able to ensure that their experience is positive and they are able to then enjoy their whole healthcare journey. Having then said what it is that we can do, I'd like to spend another 2 or so minutes just referring to a set of customers that we've been able to work with. We see ourselves, like I mentioned at the beginning of my presentations, as an enabler and accelerator towards digital health. And this slide then demonstrates the number of partners that we work with across different parts of the world. Some are very familiar to us on the webinar, and some may be new to us. But I'm going to I decided to just speak on a broad-based set of 4, 2 outside of Africa and 2 that are not just only in Africa, but also in East Africa. And therefore, I'd like to start with Philips, who pride themselves in reinventing healthcare for billions of people around the world and have built what they're calling a health suite digital platform. The health suite digital platform is built on our platform, on Amazon Web Services, and they're then able to analyze and store millions, we call this petabytes, because this is 40 petabytes of patient data gathered from millions of imaging studies, medical records, and patient inputs to be able to give the healthcare providers actionable data, which then enables them to then impact patient care. And I'll be referring to this just towards the end in a moment, as I even move to our second organization that I'd like to refer to, which is SANA. SANA, again, is a leading supplier of health information technology and has been able to create population health level tools with us as Amazon Web Services. And they're able to pick, as we speak right now, to pick data from 240 million people and then expose it to tools for both machine learning and then incorporate it into what they call standardized knowledge, and then use that to discover what the data can tell them in a very efficient way. What
2 more minutes?
Thank you, Dr. Ademola. 2 minutes is perfect. And what then does that mean for SANA and their customers? What this means then is that ultimately, they are then able to discover knowledge much more quickly with the tools and scalability that our platform offers them. And this makes it a win for their own patients. And therefore, as opposed to focusing on the everyday aspects of maintaining their suite or their technology, they're able to focus on very healthcare specific aspects and deliver more quickly at a higher value. The last 2 operators I'd like to refer to in a minute before I close is 2 that we've been working with during the COVID-19 season, and that is both Nairobi Hospital and MP Shah, just straight out of here in Kenya. And what we were able to do, as some may be aware, Nairobi Hospital has a nursing school, and during this season, the nurses struggled because of the limited movement. We were able to partner with them and enable e-learning to continue on a virtual platform that is then on Amazon Web Services. What this has ensured is that learning did not stop. It only did so for about, I think, about a week or 2, but then they were fully set up and able to move on. And therefore, virtual learning looks like it's actually going to be the way of the future in this particular organization. The second piece is MP Shah, who, again, worried about the patient footfall, actually reached out and were able to come together and enable virtual consultations between doctor and patients, again, accelerating access. As we move towards the last slide, what we're trying to say is that, quoting a member of who's pretty regular on this panel, Dr. Githinji, he refers to health being the most fundamental right and on which all other rights really can be enjoyed. And then when I think about a quote by the president, by the African Development Bank, who says we really have to be impatient in moving Africa forward, I'm reminded of the mobile money innovation that was done very specifically, global technology thinking, but that was done very specific and with a niche mindset for the people of a region like ours, meaning that the technology then became an enhancer, it became an accelerator. And we therefore see ourselves as Amazon Web Services as that platform to enable technology that is global, technology that is innovative and scalable, but that serves, together with the various partners on this platform today, to really accelerate so that we can be impatient in moving Africa healthcare forward. Thank you very much, ladies and gentlemen, for your time.
Thank you very much, Robin. I mean, this has been quite interesting because in a previous life, I used to be head of division for health, nutrition, and population of the African Union. And at that time, we had a telemedicine initiative, and I was quite frustrated with it because we had various initiatives in different countries. One, they couldn't speak to each other. Two, we couldn't scale them. Three, it was just parallel vertical system. And at that time, it was obvious to me that Africa suffered from an acute case or acute on chronic pilotitis. Africa was riddled with pilot initiatives all across the continent, but we couldn't take it to scale. So it's important that you've mentioned scale, and that's one critical thing that we need to begin to look at if we're going to be able to ensure that this bears fruit for the 1.2 billion plus citizens on the continent. So thank you very much. It's my pleasure now to invite Ms. Chemu Langat, who is regional head for Medtronic on the continent, and she's going to give us her perspectives, and we're going to also interrogate these issues through her lenses. Thank you, Chemu. Take it forward.
Thank you so much, Dr. Olajide. Good evening, good afternoon, and good morning. I hope you can hear me okay. I would like to just start by being grateful for our health and the ability to be here together today, and to thank the Africa Health Business Team, the Medtronic Foundation, for the opportunity to join and share with my fellow esteemed panelists. My name is Chemu, and I lead the Africa regional activities for Medtronic Labs, not for Medtronic. Medtronic Labs is a subsidiary of Medtronic. Medtronic is a global medical company in 160 countries. But Medtronic Labs is a standalone social enterprise with local entities operational in Kenya, Ghana, and India. Our mission is to expand access to healthcare for underserved patients, families, and communities across the world. And we do so in a very unique way. We design locally appropriate healthcare delivery models with and for the communities. And we do that on the foundation and the backbone of digital health and bringing in product technologies to emphasize that. We can't do this alone. We do this in large partnerships, and I'll talk through some of that as we progress, because that is the way to amplify impact and scale. One of my key learnings before I jump into the next slide is that over the last 6 years, we've been making strides in digitalizing health systems across Africa and the world. And to really flourish and maximize impact, they have to have adequate service delivery models that make that last mile happen. They cannot just be an app that is deployed that we hope people can access. They cannot just be a computer-based system that we set up in facilities that we hope are used. They have to be supported by and work within this larger ecosystem that takes into consideration the human resources and the infrastructure. So going on into how we came into being and why we are working on what we're working on. Globally, more than 2/3 of deaths are attributed to non-communicable diseases or NCDs. And the burden of these diseases is rising disproportionately in lower income countries. In some African countries, NCDs actually attribute to more than 50% of reported adult deaths. This means that NCDs will soon be the leading cause of ill health, disability, and premature death. And there's a huge impact on the socioeconomics of the continent. But we also know with the onset of this pandemic, COVID-19, the prevention and the treatment services for those non-communicable diseases have been severely disrupted. And that was also emphasized by the WHO Director General in the last couple months. NCD patients are also some of the most vulnerable to the impacts of the COVID pandemic due to the underlying conditions, which irrespective of age, puts them at increased risk of severe illness or even fatal complications should they contract COVID-19. As such, our focus has been to continue work on the non-communicable disease space in Africa, and I'll talk through what we've been doing over the last 6 years, but also what we've had to adapt to in light of the pandemic and how we're taking those lessons learned forward. Moving on to my next slide, I'll share more onto the Empower Health program, which is our flagship NCD solution in Africa. The Empower Health model links the patient community with the healthcare facility. It doesn't replace the standard of care that they currently receive for their NCD management, but it provides a supplemental tool to increase efficiency, increase convenience, and make NCD care more effective, cost-effective. Workflows that we have designed over the last few years have been designed to work flexibly within the healthcare system on the private and public side, but also to more comprehensively address task shifting and ensuring that NCDs can be managed at lower levels of care effectively to ensure that we have appropriate upward and downward referrals of patients should there be a need, but then also ensure that we can help our patients improve on their adherence, since we know most of these NCDs are chronic in nature. I'll walk through the model just to share a little bit before we progress into more of the applications. So the way the model works is screening is performed at the healthcare facility triage locations or is carried out in communities through community health workers doing their household visits or carrying out screening camps or through other locations such as churches. Based on patients' readings of blood pressure, blood glucose, and other cardiovascular indicators, they'll be referred to the facilities closest for diagnosis. Once diagnosed, patients are enrolled into the program through the clinic or hospital by a healthcare provider, typically a nurse, but maybe a clinical officer, medical officer, or even a physician. But what follows is a digital health solution that allows for personalized follow-up plans that are automatically generated based on algorithms that take into account demographic data, baseline biodata, risk factors, and comorbidities. Following that, at the community level, we want to make sure that the care is being continued close to where the patient is. So we have community-based blood pressure, blood glucose check capability through community health workers or other locations, or through our patient app to provide patients more convenience and timely feedback between clinic appointments. Those checks also allow for actionable feedback to the patients on their readings. The software application also allows for longitudinal management of the patients, seeing their data over time, providing triage reports and interactive graphs. And we've built in a notification system such that if a patient has a high reading or concerning symptoms at the community or home level, that not only will they be referred, but someone at the facility will be notified via SMS. So there's a follow-up mechanism and there's ability to intervene earlier. Lastly, we've built in e-prescriptions and also the ability to use the vast data that we're collecting that Mr. Njiru referred to. You may be collecting a ton of data, but how are you actually using it? Are you using it? And what we're finding in many cases is we collect it, but it sits or it's not utilized in the way that it should be in terms of being able to draw the most insights from it. So we've built out a data analytics tool to help inform and assist with planning, operations management, outcomes tracking, population health, and it incorporates Kenya's NCD indicators to improve reporting at the facility, at the county or regional level, and at the national level. I'll walk into an example of how we're using this digital health solution in a larger partnership in the public sector in Kenya. Afyadumu is a partnership that began less than half a year ago, and Afyadumu, for those who are not familiar with the Kiswahili name, means lasting or strong health. And it's a partnership between Kenya's Ministry of Health and 3 county governments of Makueni, Kakamega, Nyeri, Medtronic Labs, Novartis Global Health, and Management Sciences for Health, in conjunction with the patient advocacy group Kenya Defeat Diabetes Association. So what it does is it brings together partners who have strengths in various areas to build up that infrastructure into the public health system and allow for health and service delivery benefits, as well as capacity building of health workers and access to quality affordable medication through Novartis's Access program. The NCD solution is aligned with the Kenya national and county strategies for health system strengthening, capacity building, and task shifting. And while we had made way in the first probably 9-10 months of the program, the pandemic has really helped us test the flexibility of digital health-based solutions and leverage the ability of those to fill gaps where we cannot have the physical presence that is so typical in our healthcare system. I'll walk through some of the adaptations because I think that's where we've learned the most. And while the program itself had telecounseling built in, what we have had to do is actually expand that service, not just to those patients who are being lost to follow-up or those who need referrals, but actually seeking to engage all the Empower Health patients who are on the system that are part of Afiadumu to educate them on COVID-19 and safe practices, address many misconceptions. There are tons of misconceptions that our patients are actually truly believing and exercising activities based on. So we've had to use that service to really correct the misconceptions, address the fears, address some of those challenges that are turning them away from what they need to have as health-seeking behavior, and also provide information on some of the healthcare changes. When a facility turns into an isolation center, what happens next? How do they still seek care? And then where there are shortages of drugs, where do they turn to? So the telecounseling aspect is one that will continue to expand. Makueni County has also requested that this be expanded for their COVID-19 patients who are in quarantine at home. And so that's one we're also looking at continuing to support. Also, thank you. So also we've also been, I think another area is looking at how do you engage patients virtually. So looking at leveraging patient support groups in conjunction with our partner KDDA. So we've started that, and having patients engage us questions from nutritionists and gain level of accountability as well. As lastly, I think what we are all focused on is also making sure that our health workers have sufficient PPE, which seems much simpler in theory than in practice, and having to do that in partnership is the way to go. Moving on to the next slide, I think the learnings from this have strengthened our commitment to making sure that we are building robust digital health solutions, and we're using innovation and strategic partnerships to improve quality of access to healthcare for our patients, as well as helping them achieve and remain in control and manage their chronic illnesses in spite of the pandemic. We value our health workers of all cadre and know that they're sacrificing tremendously at this pandemic time, and we continue to support, protect, train, and equip them with tools that help them see more patients more efficiently. And lastly, ensure that health delivery is sustainable and integrated into long-term plans, including UHC in the countries we're operating in and in the ones we hope to operate in the future. On my last slide, just to thank everybody who has been supporting us along the way. These are mutual commitments that we are making, and we look forward to continuing the dialogue on an integrated digital health ecosystem that considers the technological aspects, infrastructure, human resource aspects as well, that are needed to ensure that the impact and sustainability are in place to achieve universal health coverage across the continent. Thank you all.
Thank you very much, Shemu. This has been quite interesting. I do remember that in 2011 April, African Union Ministers of Health convened in their 6th ordinary session, and the theme was non-communicable diseases. And at that time, it became obvious that Africa was at a critical intersection where we were having concurrently epidemic proportions of non-communicable diseases as well as communicable diseases. And we needed to keep an eye on both without losing the plot on either. And so it's important to see what is happening, how we can leverage digital health, and how we can leverage the necessary partnerships to reach out to the people to address a lot of the misconceptions that ultimately empower the patients. So this has really been great. Thank you very much. So it's my pleasure right now to invite our next speaker, who is Nicole Speaker, Director of East Africa Farm Access. And she's going to also be giving us her perspective. Nicole, I see you. Thank you very much for joining. Take it away.
Thank you very much, Chair, for introducing me, and welcome everybody joining this discussion on a Friday afternoon. Great numbers here. It's either due to the lockdown or everybody's really interested, but I hope it's the content that is driving everyone to this session. So thank you very much to the organizers, Amit Tucker and his team, for setting up this great and very timely discussion around the use of digital healthcare in Africa. First slide, please. So my talk will be highlighting two examples of our own work. So my name is Nicole Speaker. I'm the East Africa Director for Farm Access Group, normally based in Nairobi. As an organization, we work across the African continent, both in West and East Africa, to improve better access to better healthcare for all Africans, including the low-income groups. We do that by organizing demand for healthcare, and especially in light of the universal healthcare coverage discussion, getting people to move from post-payment into prepayment mechanisms, including insurance pools, to help strengthen their access to care and to avoid catastrophic expenditure. At the same time, we aim to strengthen the quality of care that is provided both in the public and the private sector by introducing and expanding the use of quality standards and quality improvements. And also, and with a focus on the private sector in that case, help create access to affordable loans for even the smallest healthcare providers up to medium and large-sized hospitals who need capitals but are not always able to access this at the local bank. And in fact, we see at the moment that access to capital in this COVID crisis is one critical area, as actually a lot of healthcare facilities are losing income. And we've been especially focusing on helping to make sure that facilities are still able to pay their staff, but also able to pay for medication and PPEs. We believe that digital technology is an enabler to make all of this work, and that we can only achieve universal healthcare coverage with the use of digital technology. And as I mentioned, I wanted to deep dive into two examples of how we've been using digital technology to a scale. I liked the challenge that our chair gave us to make sure that we avoid too many pilots, but also I'd like to show you how we can use that to have a better pandemic responsiveness. So next slide, please. What you see here is one of the things that we developed in a partnership in the past 5 years is M-TIBA, M for mobile, TIBA for treatment in Swahili. We developed it together with Safaricom, the telco company that most of you will be familiar with, as well as a startup company that actually we initiated called CarePay that is based in Kenya. The platform is very similar to M-Pesa. So most people will know its look and feel, and you can use it on a simple feature phone. You don't need to use a smartphone. The platform connects patients, payers, and providers. So the patient opens a simple health wallet, and you see that on this picture, what it looks like, opens the health wallet when they are at a healthcare facility, and the healthcare facility has a unique till number. So the system recognizes that the patient is at a healthcare provider, and at that moment, the funds in the health wallet are unlocked to pay for healthcare services. Now, on the payer side, as you will all know, the payment for healthcare services is very fragmented. But with this approach, the system is smart and can therefore see if healthcare services is paid for by a donor, by an employer, by the NHIF or the NHIS, or by the government. So it's able to combine fragmented pools of funding at the level of the patient. So the patient is empowered to access these services. And the nice thing about it is that these financial services are then accessed through claims management by the healthcare provider. So they also have a digital system on their end of the platform. And that translates the financial information into medical information. Now, why is this so critical? I think not knowing what the utilization and what the cost of services are one of the critical reasons why universal healthcare coverage is struggling to reach the scale that is needed so much. But also what we've seen, and in light of this COVID crisis, is we actually had on the African continent already a few bad pandemics going around. And that is Ebola, that was a very famous one. And that lasted for a very long time. And one of the big problems with the Ebola crisis, it lasted long because there was a complete lack of data and information. So you really need to have real-time information of what is going on in your healthcare facilities, what is going on with your patients, and see if this can help you understand if emerging diseases or emerging pandemics are knocking on your door. Now, with the MTBA platform, in the past 5 years, we've been able to connect 4.5 million Kenyans to the platform and more than 3,000 healthcare facilities. We're also started in Nigeria and Tanzania at the moment. And with this huge reach and impact and partnerships with various counties and the national government and the NHIS, we were wondering if we could actually use the medical information and see what the pandemic is doing in Kenya, because we all know that the testing is limited and information is very limited and very scarce at the moment. So if you move to the next slide here, what I've shown you, and it's always a bit difficult to show it in detail on such a small screen that probably all of you are behind, but on the left side, you see graphs of how various diagnoses are ongoing in these various patients and healthcare providers at the moment. And we're able to select this and select COVID-like symptoms such as upper respiratory tract infections or coughing or fever, so that even though you may not be able to test and confirm it if it's COVID, if you would see this impacting the number of diagnoses that you would see, and especially the age groups that it's impacting, it would give you a good indication for a county or a region if COVID is knocking on your back door. And actually what you see here, and you see it a bit highlighted in the graph on the right, is that one thing that is happening is that at the moment, although the COVID crisis is there, the impact and the number of people that are critically ill is very different from the numbers that we have seen on the European side of the world. And it also has to do with that it's a very different patient group. The countries that were impacted badly in Europe were countries like Italy and Spain with an aging population. And we can all agree that the African continent has a very young population. There's a lot of unknowns about this disease, and we need to find out much more. But what you see here on the right side is that at the start of the first COVID case and the start of the first curfew, dramatically dropped the number of people accessing healthcare facilities. We were able to pick up some of our maternal child health programs by really proactively engaging with patients. But what is worrying from this data is something that we've also seen from the Ebola crisis, that we may end up with a huge cost of this crisis by increasing mortality and morbidity of all these other diseases as a result of these lockdowns. And that is important information where moving forward, and if we're faced with a second or even a third wave, we should use these kind of digital technology innovations to be much smarter about our lockdown and our informations to the patients, so that we don't end up saving a few from COVID, but losing a lot on other diseases. On the next slide, please, is another example of something that I'd like to share with all of you, as we have been using the MTBA platform to really understand how patients are accessing healthcare services if we're seeing more COVID patients, and also how it's impacting other disease treatments and these healthcare providers. The other critical aspect, and Ms. Chemo, who was before me, already alluded to this, is that getting these healthcare facilities prepared for the pandemic is critical and yet is extremely difficult. These healthcare providers, again, see examples from the west of the world who are talking about ICUs and complicated care, and yet getting very basic PPEs to protect the health workers is a struggle, when we know that if there's one group that is disproportionately affected by this COVID crisis, it's the health workers. And we have so few of them at the continent. Let's make sure we protect them and make sure that they are safe, so that hospitals themselves don't actually become sources of infections rather than sources of where people are treated and cured.
2 minutes, Nicole.
I'll be quick, thank you. We realized, again, this is where new technology needs to come in, because this is not a time where you can wait for the annual inspections of the government to see what is there. So we developed a self-assessment checklist based on WHO guidelines, and we've been sharing it with healthcare facilities across the continent, where healthcare facilities themselves can download this information check against the type of supplies that they, for their size and scope of healthcare facilities, should have, but also assess against products and services and protocols and guidelines that they should have, such as safe triaging systems and hand washing facilities. So it's a quick checklist, only 35 questions, because patients and providers should be focusing on treatment, but it gives them an overview of what they should be having and access to example guidelines to help strengthen their response. And again, if you move to the next slide, an important aspect is sharing that information at the level of stakeholders and governments and decision makings, who we've then been sharing these dashboards with. And you see on the left side already the various countries where people have downloaded the app and started using it, so that these stakeholders can start making decisions about where to provide and strengthen the availability of supplies and PPEs, because patients are showing up everywhere, whether it's public or the private sector, and we need to have an inclusive response and strengthen them there all. And I also feel that private sectors can really play a role when, as the healthcare sector is, burdened with this disproportionate disease burden, that we share and strengthen the health system together. So with that, let me end there and move to the next slides, just with a link to the SafeCare app and the SafeCare documents that we have. As you can see, we've also translated them in Kiswahili if people want to use it. They are free to use, or email me with any further questions. My address is listed here below. Thank you very much, and I move the word back to the chair.
Thank you very much, Nicole. I mean, this has been quite interesting. Given that I come from a part of Africa where issues like prepayment mechanisms are a little bit difficult for us, we just keep saying, God forbid. And then we find ourselves ill prepared. And I'm actually quite impressed on the fact that you were consistent in using universal health coverage throughout. I once sat with senior health officials and I was asking, so what are we trying to do? The guy on the right says we're doing universal health care. The guy on the left says universal health coverage. And obviously they mean different things and they require different approaches. I think one of the things we have to do right, if we're going to be able to leverage technology and all it provides, is first of all, agree what we're trying to do. But I think we will try to get there soon. It's my pleasure at this point.
Thank you.
To bring in Brian O'Connor, who is the chair of ECH Alliance, and he would also give us his perspective. Brian, over to you.
Thanks very much indeed. It's been very interesting for me so far. I don't know about the audience, but I've been fascinated by listening to the other panelists. My name is Brian O'Connor, as you say. I'm the chair of the European Connected Health Alliance, though it is better known these days as ECH Alliance. I started this about 10 years ago because I was annoyed at the fact that so many good people exist in so many parts of the world, but do not know each other. There are these silos throughout the world. Not just in health, I suspect, but so I decided to create, rather ambitiously, as it was only me at the time, the European Connected Health Alliance. And the objective there was to make sure that we brought together governments, payers, providers, industry, both large and small, patient groups, economic development agencies, funding agencies, including private equity, venture capital, etc. Because I believe absolutely in collaboration. You cannot, no one that I know has all the answers. And those who think they've got all the answers simply don't. What we did before COVID was, I'm pleased to say, was to create a partnership with Africa Health Business, with Amit Nishit and Christine and so on. And we're working together on a number of specifics. The basic idea is, if you move forward to the next slide, was that we believe very strongly that a global pandemic requires a global response. Now, you'd think that was quite obvious, but all you've got to do is look around the world and realize it may be obvious, just like common sense. It's not very common. And you have countries diverging and people refusing to accept we're in a crisis. People who simply will not do it for political reasons. And whilst I would not want to quote the current American president, I would just quote a different American president, who many of you may remember, John F. Kennedy. In one of his speeches, he said this famous thing about, ask not what your country can do for you, but what you can do for your country. I think that's just as applicable to this situation, because I do believe genuinely while we all may have different reasons for doing things, whether it's commercial, private, public, we have a duty as human beings to actually come together, set aside any differences there may be, look for the areas we can collaborate on. So we have created, during the COVID crisis, this Global Connector Partnership, which includes, of course, Africa Health Business. It includes the ATA, which is the American Telehealth Association. It includes the Commonwealth, with 53 countries in the Commonwealth. It includes our friends in India. It includes our friends now in Latin America and Brazil. And because we believe strongly that a partnership such as this allows each of us to listen, which I'm not sure we all do enough of, but to listen, to learn, to distribute not just best practice, but we are focused on real actions, not blah, 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 as I call it. There's a lot of blah, blah, talk, 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 and I just get fed up with it all. So therefore, I am very much in favor of actions. So let me move to the next slide and say to you the way what we have discovered. We have 42 communities across Europe. These communities are multi-stakeholder. They are permanent because you can build relationships, not in a one-off event, but over a period of time with people. We then find that very often in our ecosystems, as we call them, we find that rivals happily work together to find a solution to a particular problem. Then they compete again to be the supplier of the solution. That is fine. But there's no point in owning 100% of a market that doesn't exist. You really have to help create the market. So we started, and we are focused on understanding the needs. And as you said earlier, Chairman, when you ask someone about universal health coverage and you get different terminologies, you have to drill down and say, do we mean the same thing? Too often you find we do not. So we have drilled down, and never stop understanding needs. When you are able to do that, we search for, among our many partners across the world, solutions to those needs. The missing element often in some countries is funding. Sometimes we can get funding. We do a lot of EU projects where their next budget is meant to be 80 billion euros for research, innovation, and implementation of solutions. So we look around and try to join those three together, because some brilliant people with brilliant solutions have no money. They need revenue, they need resources. And when I listen to the other panelists, including AWS, for example, I can see where partnerships with AWS can be a real enabler for all of us. So on the next slide, because I don't want to take up too much time, is summarize. We believe in closer collaboration. We believe in learning from successes. And can I just say, it's very important for people to be prepared to talk about their failures as well. Because things that didn't work somewhere, when you examine and analyze why they didn't work, you learn again, and maybe they're a success next time. The other thing that I feel strongly about is that I worry sometimes that in the rest of the world, they look at Africa, and those who are not educated about Africa's potential, and not just potential, but actual delivery of digital health solutions, think that they have nothing to learn from Africa. I reject that completely. It is absolutely clear to me, not just today's panel, but listening to AHB and others, that we in the West, let's call it, can learn a lot, particularly from your approach to frugal innovation, which we in the West have too much money. We spend too much money developing something. I think we can learn a lot from yourselves, and I intend to. The other thing just to say is that it's not just about best practices. We have to be very specific, because I would love to talk to the panelists later or in the next few weeks, because I can see where we have solutions in all the countries we cover, which really could help Africa. And you have clearly got solutions, much more advanced than most people know, to help the rest of the world. So the final slide, I think, just coming up, is that I just want to thank you for including us, a European entity, in this conversation, because I think this helps future connectivity and hopefully future collaboration. Thank you. Yield back to you, Chair.
Thank you very much, Brian. And I can't help but ask, where were you years ago when I was head of health for the African Union? Because a very tedious process. I resumed, and within the first 2 months, my first task was to evaluate the level of compliance of African Union member states to the Abuja Declaration of 5%. And I was to present that outcome to the ministers of finance. So it was just to look at, so I thought, okay, simple. We'll just look at how much was allocated to the health sector. Oh my goodness. Some countries had ministries of health. Some had Ministry of Health and Water Resources. Some was Ministry of Hospital Services. Some was Ministry of Health Environment. So we did not even have uniformity as to what we were comparing. It became a big challenge. And then we tried to have meetings of ministers of health and ministers of finance, because we found that the health ministers go on the side and make commitments that they have absolutely no powers to fund.
And just so if I can just respond to you by saying this, where was I? I was probably hiding from you because I had enough to do. The second thing I would say is this: I'm a great believer in doing and asking for forgiveness afterwards, because when you ask for permission, it takes so long to get permission. The idea has lost its emphasis and its use. So we'd be happy to collaborate with everyone who's on the panel and everyone who's listening, because we believe the global response to this cannot just teach us about COVID and deal with COVID. It is the fundamental infrastructure we need if we're going to solve future pandemics and indeed progress for everyone.
Definitely, and that's a very nice place to anchor and get on to the next speaker. I would again share an anecdote. In 2010, African Union heads of state and government met at an AU summit. I would not say where, but I'm sure a few people would know. And the theme of their summit was maternal, newborn, and child health. And the host head of state, who had been preparing for 2 years for that summit, got up in plenary and asked, of all the problems in Africa, how did this get onto our agenda? At that time, he didn't seem to appreciate the fact that health was something that heads of state had to engage on. Well, I'm sure he has changed his mind by now. So thank you. It's my pleasure right now to invite Chris Legrand, who is the CEO of Broadreach, who is going to be our discussant and just put a lot of what we've heard in perspective. Chris, over to you.
Great, thank you, moderator, and all the other panelists. So I thought I would give a few summary comments, trying to think about some of the common themes. But first, if I could just spend just a moment on some of our own experiences that we've had. If you can move to the slide, please, within Broadreach. So Broadreach, if you're not aware of us, is a tech-enabled health solutions company based in South Africa. And for better or worse, we've been right on the ground trying to address COVID in some of our large PEPFAR programs. If you can go to the next slide, please. So we, with our own experience with having to address COVID on the ground, we quickly saw with our large PEPFAR program the issues of trying to balance supply and demand. Essentially, already a substantial demand around HIV patients, but then we saw the need around COVID, and then looking at the supply side, trying to balance and manage what's available in terms of staff, in terms of facilities, in terms of PPE, these sorts of things. So we pretty quickly said, what can we do as an organization to help on the ground around balancing this supply and demand? So if you can flip to the next chart. So with our Vantage technology platform that Broadreach has developed and actually uses on our own programs and others, we quickly rolled out a series of new technology solutions to meet these issues right on the ground in terms of balancing supply and demand. And with that, flip to the next chart, please. We launched this series of technology solutions, and over the last couple of months since we launched those, we've actually screened more than 2 million South Africans, going door to door, and also training government health workers to go door to door with this technology on their mobile phones that allow them to go and screen and quickly assess people as to their need to go for further treatment. We also, in parallel, did a facility assessment and rolled out a facility assessment that, again, tried to balance this issue of supply and demand. So this technology, Vantage technology, continues to operate at scale on our own PEPFAR programs and others across several districts within South Africa. So there's a lot of real-time learning on our part, and I think you'll see some of that folded in some of the summary comments that I'll make as well. So if you can flip to one other chart. The one other thing that I wanted to point out, and this will bring back one of the comments I think that both Nicole and also probably Robin made around harnessing data. So we, as Broadreach, as an implementer of the PEPFAR program in South Africa, sit on a substantial amount of information around HIV patients. And we have developed a series of predictive algorithms for what we call loss to follow-up, or people who may be at risk of not coming back for their treatments. We quickly adopted that technology to look at that existing set of patients and their comorbidity with COVID-19, and then rolled out a series of messaging programs to be able to drive those HIV positive patients to their facility to make sure that they actually continue to go to get their HIV meds, and also that they went in for additional COVID testing. So that's an example of using both the technology that's available and the data resources that we had already to focus on targeting interventions around people who are already at high risk. So a lot of good hard learning for us and others over these last few months. The last chart. So that's obviously funded in part by our PEPFAR partners and USAID and other partners that we work with. And I'll come back to this issue of partnership in just a minute. So let me just step back and see if I can summarize a few things that I've heard today from some of the other panelists. So the first I would say is data. When we think about COVID and digital health, access to data, and that's access to robust, high volume, timely data. We heard Nicole mention access to real-time access to data and information. And we heard Robin speak about it's not data for just data's sake, because you see the slides that I just presented. We actually take data and actually make real use of it. That's one of the important themes of, I think, of COVID is data is essential, but it's how you use that data, how you harness that data to create new knowledge. And we have the opportunities these days with artificial intelligence and predictive algorithms for using the power of data to actually make decisions on the ground quickly to get people into the right kinds of healthcare treatments for COVID. Second theme that I'm hearing is scalability. And we've seen this on our own PEPFAR program. I think it was our esteemed chair who mentioned pilotitis that he had seen over the years. And we've seen, I know many of us have experienced lots of interesting pilots for digital health. But the reality is COVID focused us around, we can't do pilots right now. We need scale. COVID quickly required scale, whether it was in South Africa or now in Kenya, and now we see dramatic increases in number of cases in places like Nigeria. So scaled approaches that are built on robust infrastructures, whether it's the infrastructure that our Broadreach team uses, underpinned by Microsoft and the Azure platform, or Amazon Web Services. These are the sorts of things that the African continent can take advantage of now to do things at scale. So the time for pilots is over, the time for scale is now. The third theme that I would say, and I've heard this again through several of our talks today, is agility, the ability to nimbly move when we start to see new emerging issues, when we start to see things that weren't working that we need to learn from quickly. This is adaptation of programming that we can adjust quickly to create new insights and address issues on the ground quickly. And I think we've seen this throughout all of the discussions today, the ability to adapt and be nimble and move quickly. And then the fourth theme that I heard, I think through every one of our speakers today, is leadership. Fundamentally, nothing happens without leadership. I like to say, and I've heard many others say, leaders cause things to happen that weren't just going to happen anyway. So COVID, if you look, whether it's in the United States or throughout the African continent, is increasing asymptotically. Without leadership, that will continue to increase asymptotically. So I heard, I believe it was Brian mentioned JFK. I'll reference two other leaders that I sorely miss and wish that we had today. Neither of whom was a perfect leader, by the way, but together, Churchill and Roosevelt caused things to happen that weren't going to just happen anyway. That's an example of leaders coming together at a global level that caused things to happen. And I sorely wish we had those sorts of leaders today. I won't reference our current president of the United States either, Brian, thank you. Leaders create trust. Leaders cause collaboration. Leaders cause partnership. Leaders inspire teams to do things they never thought they could do individually. And leaders also break down those silos that Brian talked about. They create networks of partners that even if they're sometimes competitors, those leaders cause partnerships to happen for the greater good. For something like COVID, where we absolutely have to work together, and that's the only way we can do things at scale and address things across the African continent and beyond. And I would just say that also, I think, Brian, your comment about Africa has a lot to teach to the rest of the world. It's been really apparent to me sitting back here in the United States now, how completely broken our healthcare system is in the United States. We have some of the best healthcare in the world, some of the best health scientists in the world, and yet we can't seem to get out of our own way. And I would bring that back fundamentally to leadership. So really, the African continent has the opportunity to take some of what we're already applying now from a digital health standpoint, and ultimately from a leadership standpoint, to actually take that back to the West. And so I'm looking forward to these next few months as COVID continues to rage, that we can take some of what we're learning, the hard lessons that we've already learned in HIV and other areas, back into the West to cause things to happen in the United States and the UK and elsewhere that wasn't just going to happen anyway. Thanks very much, Mr. Chairman, and I'll turn it back over to you.
Thank you very much, Chris. Indeed, this is very interesting. The role that leadership plays is one that we cannot really begin to underscore, because it's something that is very critical. At this point, we're going to go on to have a video, which is about the partner spotlight, and then we're going to come back and then have some questions and discussions and then round up. Okay, HB, let's have the video.
A group of distinct businesses focused on a common goal of improving the health and well-being of underserved populations around the world.
We are Broadreach Healthcare. We focus on winning and delivering large-scale health system strengthening programs for donors like USAID in programs like APACE.
We are Broadreach Consulting. We implement Vantage and provide associated change consulting to help clients improve their healthcare outcomes.
We are Vantage Technologies. We developed the Vantage platform that enables delivery consistently and at scale.
Together, we make up the Broadreach Group. Empowering action, changing lives.
AWS is the world's most comprehensive and broadly adopted cloud platform. Millions of customers trust AWS to power their infrastructure and applications. Organizations of every type and size are using AWS to lower costs, become more agile, and innovate faster. AWS provides on-demand delivery of technology services via the internet with pay-as-you-go pricing. You can use these services to build and run virtually any type of application without upfront costs or ongoing commitments. You only pay for what you use. AWS gives you more services and more features within those services than any other cloud provider. This makes it faster, easier, and more cost-effective to move your existing applications to the cloud and to build anything you can imagine. From infrastructure technologies like compute, storage, and databases, to emerging technologies such as machine learning and artificial intelligence, data lakes and analytics, and Internet of Things. Building on AWS means you can choose the right tool for the job. For example, AWS offers the widest variety of databases that are purpose-built for different types of applications. With AWS, you can leverage the latest technologies to experiment and innovate more quickly. We are continually accelerating our pace of innovation to invent entirely new technologies you can use to transform your business. Like pioneering the serverless computing space with the launch of AWS Lambda, which lets developers run their code without provisioning or managing servers. And AWS built Amazon SageMaker, a fully managed machine learning service that empowers everyday developers and scientists to use machine learning without any previous experience. We are constantly expanding our global network of AWS regions, so you can access AWS services to build and run your applications from anywhere in the world. Each of these regions has multiple availability zones that are physically separated from each other and connected by low latency, high throughput, and highly redundant networking. This makes it easy to design and operate applications that are scalable, fault tolerant, and highly available. Our infrastructure is built to satisfy the security standards of the most risk-sensitive organizations. You also have access to the AWS Partner Network, which has thousands of systems integrators who specialize in AWS services, and tens of thousands of independent software vendors who adapt their technology to work on AWS. With the largest community of customers across every industry, AWS has unmatched experience and operational expertise you can depend upon for your most important applications in every imaginable use case.
Thank you very much, ladies and gentlemen, panelists. This has been a very interesting conversation. Of course, our time is very fast spent, and so we're going to be a little bit efficient. Colleagues from AHB are going to ensure that a database is created where the questions will go to the panelists and where we can take time to respond to each of those questions in more detail, and then have bilateral conversations that allow us really ground a lot of the issues that we have raised, given the limitations of time. So what I'm going to do is, looking at the questions we've had, I'm going to pose one question to each of the panelists, touching on what people have raised. And in answering that question, the panelists would also give us their parting shot. And so we're going to be as efficient as digital health technology is going to cause us to be. And so we're going to start, of course, with Robin. The question is around issues of regulation. We've talked about the importance of data in terms of being able to analyze data, scale up data, and a range of that. People are concerned, do we have the regulatory systems? What about the security of people's data? How do we see that functioning and what needs to change? Give us your perspectives on that quickly and give us your parting shot. Thank you, Robin. Robin, you're on mute.
Sorry, needed to unmute that. Sorry about that. So thank you, Dr. Ademola. I was just saying, I'm going to answer that in 3 parts. With respect to data security and data sovereignty, from a security perspective, actually, we are fully compliant to HIPAA, HIPAA, and several other, in terms of healthcare regulatory requirements. And therefore, we also cover entities and their business associates subject to the country regulations. We, for example, when we talk about either global health regulatory expectations or even local, we partner with local organizations to ensure, for example, like in Kenya, whether we're talking about the Access to Information Act, whether we're talking about the Data Protection Act, we ensure that we are fully compliant, and especially as we talk about patient and health data. With respect to additional regulation, I think the delegate that asked this is spot on. Innovation will always go ahead of regulation. And I think the balance, what we've learned as we've engaged both policymakers and governments and also health leaders, is that we have to find the sweet spot between balancing between innovation and regulation, so that innovation does not go so far ahead that it becomes dangerous for the people and also the patients in this particular case, but also to ensure that regulation is not too rigid and becomes a straight-jacketed approach that ensures then that innovation is stifled. I think for us in that sense, we then ensure that all customers are taken care of, and that even from a regulation and security perspective, we remain fully compliant. As a parting shot, I think for us, you will notice that as an organization, we understand different organizations have different goals as well as different challenges. And therefore, we have a whole array of programs that support the approach by different organizations. And therefore, we are keen to engage with both panelist organizations and also other people that are on the call today to ensure that we can create alliances and partnerships to just accelerate and ensure that we can improve the access and we can scale already what we have. I think it's pretty clear just listening to everyone. There's a whole array of data. We are not deficient on data. But there is also a worry that there is a siloed approach. So there is a real need to partner so that then we can accelerate that universal healthcare access. Thank you.
Thank you very much, Robin. I'm going to go to Chemo. We're talking about getting people to be able to access health at the last mile. Now, how do we ensure that these systems do not reinforce existing inequalities, where it is those who are able to access the web, who are able to access smartphones, who are able to access all of this technology that get better access to quality care? And is it possible to adapt this for people at the far end to be able to do a self-assessment of their health status, even with regards to COVID, and then know what risks they run and how they can promote their own health? Give us the perspectives on your part in short.
Thank you so much. I think that is a really great question, especially for us, because our focus is on making sure that everybody, irrespective of where you are in the socioeconomic status, irrespective of where you are location-wise, you have access to quality healthcare that you can afford. I know that's the larger mission of some of the UN SDGs, specifically under universal health coverage. But I think it's also something that we have to build into how we design systems. We have to think of who the recipient is and make sure that the solutions are appropriate for them. So for example, in the Empower Health solution, we use SMS, and we're in the process of rolling out USSD applications specifically to reach to some of those additional areas where the community health volunteers may not be able to visit. These are inequities in socioeconomics, but then also just in technology capabilities and infrastructure. So if you don't have that last mile recipient via the community health worker, how else do you reach somebody in the village? Are there mechanisms where you can set up community groups so that they can come together and have access to a system to collect information on? Our systems work in on and offline mode intentionally to make sure that we can allow for some of those challenges with connectivity. But I think fundamentally, as we think of design of digital health solutions, you're spot on. We have to put the end users of all variety in mind and actually make sure that we're reaching them wherever we can. So my parting shot from this is related to innovation, and innovation being, it needs to address the patient, but the patient comes in so many different ways. So not also thinking of this in terms of one view, but looking across the types of patients we manage, the types of patients who we will manage in the future, and making sure that our innovations and digital health solutions are staying ahead of that to address all those potential inequalities.
Thank you very much, Chemo. Thank you. Nicole, you talked about universal health coverage and trying to get users across various member states to explore technology, prepayment modalities. How have you been able to do that? What do we need to do to be able to earn people's trust to do that? Now, for me, it took me quite a while to be able to deposit money at an ATM. I can take money from a machine, but giving my money to a machine without a name became a very difficult thing for me to do. So how can we do that? Because coverage has been, getting people to sign up has been one of the major challenges on the continent. What's your perspective? How can we do it better? What's your parting shot?
Thank you, Chair. That's a great question. And I think if I had the perfect answer, that would be the Nobel Prize standing right next to me here. But I'll still give it a shot and stand up to the challenge. I think critical to universal healthcare coverage is gaining the trust. And if you think about moving from post-payment to prepayment, and you can argue if that is insurance or that is a health pool or whatever the mechanism is, but it does mean being prepared for something that comes in the future so that you are not caught by surprise when you fall ill. And I think the biggest challenge is knowing that when that money is there, when the rich pay for the poor, when the healthy pay for the sick, that is actually being put to good use. And we all know the very bad examples that this is not always the case, and the money is put in a central fund, elections come up, and then it's gone, right? And this is the big challenge. I think this is why digital technology is such a revolution. If you think about the impact mobile money, and especially M-Pesa, has had on the continent, M-Pesa is the most trusted brand in Kenya. Ask the average Kenyan what they trust the most, it's M-Pesa. Why? Because the money never disappears. It's always there. And it shows that it's possible. This is not a thing where, this is an impossible continent, let's just give up. It is possible, and I think it's critical if we engage the private sector in this, in a PPP, because to be honest, you could question if M-Pesa would be as successful if it was a government institute. I don't know. It might be, it may not be. And that maybe is a nice little bridge to my parting shot. I think the most important aspect in creating UHC and using these digital technologies to encourage scale is looking at the way public sector contracts for these services. Now, traditionally, the money that governments have, they're very much used to either, purchase equipment, build a hospital, and even the whole tender procedures are dressed in such a way that you can only buy physical things. And yet software and digital technology is a service where it's actually very useful if a private sector company runs it. And at the same time, the government has the trust that once they purchase something, they don't create a monopoly and all of a sudden their prices quadruple and they can't afford it anymore. So I think as a parting shot, as we're thinking about scaling digital technology for UHC, let's look at how we can create PPPs and move towards a contracting structure where software is a service so that technology can scale. Governments can trust that it's operated, but private sector can trust that they get a return on investment when they're contributing to this. So thank you very much.
Thank you very much, Nicole. I'm going to go to you, Brian. Obviously, I was there at the African Union at the time when, in response to the Ebola crisis, the Africa Volunteer Health Corps was being created and the CDC emerged and all of that, because we found that Africans had to come together, create the partnerships to help themselves, because it seemed like we were on our own for what seemed to be an African challenge. Right now, we're dealing with a global challenge. What do we need to have in place to ensure that we get the necessary global alliance and partnerships to really improve our health and circumvent the political bottlenecks, which has been the greatest challenge we see in the response to COVID-19?
Thank you. My response is, we have too many organizations already telling us what they think. So I'm not going to live long enough, like 50 more years, if I was to try to reorganize them all. So I'm not going to start. I think the real secret is what I mentioned before. It is specific actions between people that you trust, people that you respect. Those successes, which will undoubtedly come from that will be the things that change the institution. So I would start at the ground floor, not at the top. I've been through this too often, and I get to the stage of thinking there's a self-preservation in every organization, and they always seem to still survive, even if they make a mess of their responsibilities. So I don't want to be the world's policeman. Just as a parting shot, I would say this. As I listened today, and I read a lot of the questions, which I know AHB are going to answer as well, it is clear to me there's a huge interest in what's going on in Africa. But please understand, there's a huge interest about what's going on in Africa outside of Africa. So please think of us as your partner, I hope, to be able to tell people about Africa, not in terms of blah, blah, but to give specific instances where we are working with people in Africa to show the success, the potential, and I believe the learning we can get from Africa. Thank you, Chair.
Thank you so much, Brian. I mean, it's very critical right now. We're inextricably linked together because the COVID has proved that very, very critically. And I totally take away your point that we actually build from the bottom. Because the elders in my village always admonish, do not climb a tree beyond the leaves. When you do that, you're coming down. So I'm going to end with Chris. Chris, obviously, leadership is very fundamental. Leadership for the countries, leadership for the continent, leadership for the private sector, leadership for the partnerships. How can we have the type of leadership necessary within creating this ecosystem without being bogged within the limits that our political leaders have foisted upon us? Because we're not going to be able to control that very quickly. But what do we need to put in place as building blocks to take us to the next level? Thank you.
Yeah, I don't think we can address the political issue. Get that and that's been with us across the world for across Africa and in the U.S. and elsewhere. I would just say that fundamentally we need to find leaders that we trust, that we can find ways to partner with, that we can look for common cause. I think in the end, sort of, if you take the political leaders off the docket for a minute, I know we have to work through them, but there are a lot of people out in civil society and in government, by the way, and in private sector who want actually to accomplish things, who want to be part of something that's larger than themselves. And I think when we can find those connection points of people that we have common cause with, that we can say, you know what, even if we might be from different cultures or we might have different points of view, that we actually have found a common interest to solve a particular issue. I think that we continue to seek those people out, whether they're in Europe or the UK or across the African continent or Asia or even the United States.
Thank you very much. I think that's a very nice place to anchor it, because everything comes back to trust. There must be trust amongst all of the stakeholders. All of us must trust ourselves. There must be trust. The beneficiaries must trust the duty bearers. And there must be trust that all of us who have been assigned responsibilities can carry it out with the ultimate goal of ensuring that those who are receiving the care get the best deal. And so for me, it's an opportunity to thank everybody. This conversation needs to be deepened, and I therefore look forward to AHB providing the platform electronically for us to begin to deeply interrogate these issues. COVID-19 has been a significant challenge. It surprised us, but then within it, it has provided an opportunity. It has compelled for us, Africa's political leadership, to look at the health sector in a way that they have never done before. Like we joke with a few of our friends, none of the African leaders have been able to travel. If they fall ill, we all die here together. So we must all evolve a solution and build the partnerships necessary. So thank you, everybody. I hand it over to AHB. Thank you.
Thank you, Dr. Ademola, for so ably taking us through the digital health session. And to all our speakers who have taken part in this session, thank you very much. On behalf of Africa Health Business, we want to extend a special thanks to all our event partners who made this event possible. We would now like to highlight our upcoming webinars. We have our manufacturing and supply session next Friday at 4 p.m. to 5:30 p.m. East African time. And as we leave, please watch a short clip on Africa Health Business. Thank you for your time and have a lovely weekend.
Thank you. Bye.
Bye.